Hey, my name is Dr. Rashmi Chandran. I am the president of AltaCair Foundation. The mission of the foundation is to serve the unserved and underserved population. So one of the major areas in the communities that has this population in density is the colonias. So that is why our first project is to do with the colonias. Not to say that we will move on to other projects like the border areas, the immigrant population, and so on and so forth. But we want to pilot with our colonia programs. So our theory of change is advocacy, listening approach, collaboration, and bridging capital. So with these four tools is how we want to work. We do not want to reinvent the wheel. We want to actually empower the organizations who are already doing the good work by filling their gaps. So the first step towards this was to do cluster meetings according to the specialty of the organization, bring like-minded people together, give them an overview of our foundation, and then know from them where are their gaps and how can we help. We divided our cluster meetings into 6 cluster meetings. We have education, healthcare, non-for-profit, government, faith-based organization, and businesses. So today was education and healthcare, which was a huge success.
So tell us a little bit more about AltaCair, because you launched here in the Rio Grande Valley late last year with that accelerator conference you had, but there'll still be plenty of people down here that perhaps don't know too much about the group.
Yes, so our focus is health equity, eliminating health disparities, awareness, advocacy. I think the Rio Grande Valley is a very unique community compared to the rest of the country, knowing the fact that we're surrounded by borders. We have a unique culture. We are an amalgamation of various cities together. We in the radius of 80 to 90 miles, we have so many cities. Each city has a city council and their own objectives. So when all these cities are working in silos, we still find so many needs that are not met. So our goal is to bring awareness, bring people together, because there are enough resources within us to get the work done and to reach the finish line.
So today you've had 2 of those cluster meetings, the ones on education and healthcare. Were there any standout things that you learned, anything that jumped off the page that...
Yes, a lot. I knew this was coming out, but there are so many programs, there are so many resources, there are so many ways to serve these unserved areas which exist between the educational institutions as well as the healthcare institution, which no one is aware of. Even within the educational institutions, we saw that there were different departments representing. One department does not know what the other departments have. So there's duplication of even resources where funding can be utilized in things which are not there. But we're not aware, so that awareness factor which went to me as well as all the attendees, that was a huge factor.
Is there anything else you'd like to add?
We want people to represent their counties, their cities. We are trying to reach out Willacy County and Starr County as much as we are reaching out Cameron and Hidalgo. I think there's still need for more representation from Willacy and Starr County to tap into those places more. There are several organizations that are willing to help. They just don't know how to get to these places. So that is the ask from the community, that please contact us, let us know that you are there, and let us know how you want us to serve you or how you can help us, and we can come together and operationalize.
And how can people reach you?
My cell phone is the best way. My number is area code 904-859-9162, or my email Rashmi, Rashmi @AltaCair, AltaCair.com.
Rashmi, thank you so much for today's interview. We've learned so much.
Thank you so much for joining us, and your presence is very appreciated.